Hello and welcome. Welcome to CARES. Today we're diving into a chemotherapy drug that many patients know simply as the red one. It's officially called Doxorubicin, or sometimes Adriamycin, and it's earned quite a reputation, even being nicknamed the Red Devil. But don't worry, today I'll help you understand what it is, how it works, and what to expect, in a way that's clear, calm, and grounded in real experience. Let's begin. So, why is it called the Red Devil? Well, for one, the drug itself is bright red, like cherry syrup. And yes, your urine may turn red for a day or two after treatment. That's normal and harmless. It's just the color of the medication leaving your body. But the nickname also comes from the fact that it's strong. It works powerfully against cancer, but it can also come with strong side effects. That's why doctors use it carefully, monitor your heart and blood levels closely, and make sure it's given only when the benefits outweigh the risks. How does doxorubicin actually work? In simple terms, it attacks cancer cells at their core. It slips inside their DNA, blocks their ability to copy themselves, and floods them with oxidative stress, basically overwhelming them from the inside out. You can think of it like a smart bomb that targets the cancer's command center, breaking it down from within. That's why it's used in so many cancers. It's effective even in small doses, and it works across multiple cancer types. What types of cancer is it used for? Doxorubicin is commonly used in breast cancer, especially as part of AC chemotherapy. Lymphomas, like in the CHOP regimen, leukemias, ovarian, lung, and liver cancers. It can be given before surgery to shrink tumors, or after surgery to prevent the cancer from coming back. What are the most common side effects? Let's go over a few that patients often notice. Hair loss, yes, almost everyone loses their hair with this medication. But it does grow back after treatment ends. Fatigue and low energy. This is very common and can be frustrating. Your body is using energy to heal, and your blood counts may drop, which adds to the fatigue. Nausea and mouth sores. We can give medications to help manage these. Rinsing with salt water and eating soft, non-spicy foods can make a big difference. Red urine. Again, this isn't blood, it's just the red medication being filtered out. It usually goes away within 48 hours. Heart effects. This one is important. Doxorubicin can affect your heart, especially at higher doses. That's why we do echocardiograms or blood tests to check your heart before and during treatment. And we stop long before it ever becomes dangerous. So yes, this is a powerful drug, but your care team is monitoring every step. Let's pause here for a moment. Here are a few of the most common questions I hear from patients. Will all my hair fall out? Yes, it usually does during treatment. But remember, it's temporary. Many patients cut their hair short before starting, or wear scarves and wigs during treatment, and in most cases, your hair will grow back within a few months after chemo ends. I'm scared about the heart damage. Should I be? That's a very real concern, and I'm glad you asked. Yes, doxorubicin can affect the heart if you get too much, but that's why there's a strict lifetime dose limit, and your doctor will never go beyond it. Also, we check your heart with an ultrasound or blood test regularly, and if there's even a hint of trouble, we stop or switch medications. So, you're not going through this blindly. We're keeping a very close eye on it. Can I take vitamins or supplements while I'm on chemo? Be careful here. Some supplements, especially high-dose antioxidants like vitamin C or glutathione, might reduce the effectiveness of chemotherapy by protecting the cancer cells too. That doesn't mean supplements are always bad, but timing matters, and you should always talk to your doctor first before adding anything new during treatment. I feel so tired all the time. Is that normal? Absolutely. Fatigue is one of the most common side effects of chemo, and doxorubicin is no exception. Your red blood cells might be low, your body is repairing itself, and your immune system is working hard. It's okay to feel worn down. Rest, hydrate, eat nourishing food, and listen to your body. If it becomes overwhelming, your doctor can check for anemia or give supportive care. A quick word on functional support. From a more holistic or functional medicine perspective, some studies suggest that things like CoQ10 omega-3s or milk thistle might help protect the heart or liver during chemotherapy. But again, this is a conversation to have with your oncology team. The goal is always to support your body without interfering with your treatment. So yes, doxorubicin is powerful. It's bright red, it's intense, and it works. It can sound scary at first, especially with a nickname like the Red Devil. But when used carefully, and with the right monitoring, it's also a life-saving drug that's helped millions of people beat cancer. If you're starting this medication soon, I want you to know you're not alone. Your team is watching out for you, adjusting things as needed, and helping you through every step. If this episode helped you feel more informed or less anxious, please consider subscribing to CARES, and share this with someone who might be starting treatment too. Thank you for listening, and I'll talk to you again soon, with more calm, clear guidance on your cancer journey.